saving lives, valuable resources.
First here at 4 o'clock, a big change if you call 911 in Clark County. Starting next month, if you do call in for a medical problem, it could be a triage nurse who helps you out. These changes in Clark County are part of a new program designed to get you the appropriate care that you need.
Yeah, Tim Gordon is live in Vancouver for us. So Tim, nurses taking 911 calls. What's the idea behind this and how could it help?
All right, well, first of all, the fact is that not everyone calling 911 has a very serious or possibly life-threatening urgent medical problem. So this will help with those calls and allow first responders to get to those serious 911 medical calls. Inside the offices of Clark County's 911 system, it gets very busy, with dispatchers taking all kinds of calls. That includes about 58,000 medical-related 911 calls a year these days. The majority of the calls are considered emergencies, but about 14,000 of them are not.
So one of our initiatives was the nurse navigation to try to bring some of those lower acuity calls into a different level of service.
Those calls that don't require a firefighter paramedic team to respond, along with an ambulance paramedic EMS crew, will now be helped by nurses trained in emergency medical care, routed to the nurses by dispatchers here. That will help with true life or death calls.
Because oftentimes we won't have the ambulances to send, and so this is going to make it so that we have the resource for the high emergent calls that we get.
The nurse navigators are already working for American Medical Response at a hub in Texas. They are not only emergency specialists, but trained in doing telephone triage, so they know what to ask callers when assessing their needs. From there, they can help them get set up and transported to clinics or possibly onto a telehealth appointment. The idea is this is better for the callers and for the entire emergency response system, from first responders to overburdened hospital emergency rooms.
But the two most expensive routes to healthcare are an ambulance and emergency room. If we could take those patients and divert them to the appropriate level of care, it saves the patient cost. It benefits the EMS system and makes those resources available for the more critical calls.
It is important to note that you should always call 911 for urgent or potentially life-threatening emergencies, and if ever in doubt, best to err on the side of caution.
So we would want to make sure that they do continue to use the 911 system if they do need it. But again, their primary care physician is also a good resource for those lower level type issues that they're having.
Yeah, and beyond that, if you're just calling to get medical advice, 911 is not the place to call. You should be calling your provider or clinic. This nurse navigation program kicks off May 16th, and Clark County will be joining 10 other states across the country and Washington, D.C. as well, where they have this program in place, and they say it seems to be working well. Back to you in the studio.
Really interesting. All right, Tim, thank you.